Are you hungry for the latest news and trends from the internet? Welcome to What's Cooking on the Internet, your one-stop shop for discovering the hottest digital delights. Hit that subscribe button and let's get cooking.
So there's a new gonorrhea vaccine out. Is it a game changer for sexual health? Or does it complicate things? Let us know what you think in the comments. The UK just started rolling out this vaccine in clinics, a world first, apparently hoping to tackle those sky-high infection rates. It could prevent thousands of cases and save a ton of money. But it also makes you wonder, what does this mean for how we think about sexual responsibility and well-being? Here's a quick rundown of what's going on. Who's getting it? Right now, it's mainly gay and bisexual men who've had multiple partners or pastis, basically, those at highest risk. This makes sense for getting quick results, but it also brings up some tricky questions. Does targeting specific groups accidentally stigmatize them? Or is it just smart to put resources where they're needed most? It's a tough line to walk between helping people effectively and making sure everyone feels included. It's not a perfect yield, but it's still huge, only about 30 to 40% effective. But don't let that fool you, it's still a massive deal. Especially with antibiotic resistance becoming such a big problem worldwide, this vaccine gives us another weapon against it, helping slow down those superbug strains. It just goes to show that even small steps can make a massive difference in public health. A clever scientific twist, here's the cool part. This vaccine, called 4-Semen, wasn't even made for gonorrhea. It was for meningitis B. How wild is that? It really shows how bacteria are connected and how existing medical breakthroughs can solve new problems. It's a brilliant example of science adapting and helping us in ways we never expected. More than just a vaccine. But let's be real. This vaccine isn't a magic fix. The UK saw over 85,000 gonorrhea cases last year, the most in almost a century. That huge number tells us there's a bigger problem here. It points to gaps in sex ed, not enough testing, and people not always practicing safer sex. The vaccine is super important, but it's just one piece of a much larger puzzle. Taking charge of your health, then there's the personal side. Take Joey Knock. For example, he got vaccinated privately and uses other prevention methods like PrEP and DoxyPEP. He's a great example of people taking charge of their sexual health in new ways. He even found his symptoms were way less severe after getting reinfected, showing the vaccine's worth even if it doesn't stop every case. This whole safer sex toolkit is growing, and now it's not just condoms, but vaccines and other meds too. It pushes us to think beyond the usual and use multiple layers of protection, but it also highlights a problem. Not everyone has the same access to these newer methods, especially between private and public healthcare. So, while this vaccine is a big step forward in fighting STIs, it also makes us think about how sexual health is changing. It's not a miracle but it's a crucial part of a bigger plan that needs ongoing education, easy access to testing, and open conversations about our well-being. As we use this new tool, we've got to keep building a world where everyone feels able to take charge of their sexual health. Real safety, after all, comes from a mix of personal choices, community backing, and strong public health efforts.